All right, guys, Dr. Shaw here.
I'm Alex Hughes. I'm a lead nurse practitioner working at Austin Urology Institute.
How's it going, guys? We're going to talk today about Barrigel. It's a product that's been in the marketplace for a couple of years now, something that we offer here at Austin Urology Institute. I will start with a little bit of a primer of what we're dealing with in terms of anatomy here. This is one of the wall boards that we have here. Everyone, I think, understands pictures, so I think it makes it easier to understand what's going on. But here's the anatomy. Here's the bladder. Here's your prostate. Here is the rectum, and this is your penis and your urethra, okay? So here is stage 1 prostate cancer, and you can see right here, here's the prostate, and here is stage 1 prostate cancer. And just to go back just a little bit, is the prostate is a sexual reproductive organ. It lives beneath the bladder, and it kind of sits between the bladder and the urethra. It secretes the vast majority, I would say 98, 99% of the ejaculate volume. 1% is sperm that comes from the vas deferens and joins up in the prostate. But that's during reproductive years. And I tell people as you age, the prostate becomes this, thing of, helps with reproduction, but as you age, it becomes a pain in the butt. I mean, to say is it can enlarge and cause BPH or enlarged prostate symptoms, pushing, straining to urinate. And the second thing is it can turn cancerous. So I often also tell women it's like your uterus. It's good for baby making when you're younger, and it's a liability as you get older. But here's stage 1 prostate cancer, and this is often detected secondary to elevated PSA. You cannot feel it with a digital rectal exam. You can't feel that little spot. Here is stage 2 prostate cancer. Here is stage 3, and you can start feeling this. And this is now stage 4 and onwards. And unfortunately, hopefully you're not catching your prostate cancer that late. Now, this is the subject of another video, but sometimes the cancer is so small, you can do something called active surveillance, where you can just kind of monitor it, because there is a chance you may die of something else before you die of the prostate cancer. And as it progresses, okay, stage 1, stage 2, even some stage 3 cases, there are a variety of additional options that can be curative. Surgical or robotic prostatectomy removal is certainly one standard of care. The other one is radiation. So the beauty of radiation is that there's no surgery involved, but I always tell my patients each option that you choose or don't choose, there's a price you pay. And the way I kind of look at it is with prostate cancer management, there's a trifecta you want to hit. One is you want to be cancer-free. The second one is you want to be continent or dry, okay? And dryness is important. I have patients that are 5, 10, 15, 20 years out from surgery, radiation. You do not want to be wearing diapers, okay? And you won't even care if you're cured or not. So you want to be cured of cancer, you want to be dry or continent, and then thirdly, you want to be potent, okay? Surgery can affect those things in different ways. But so can radiation. So what happens in radiation, we kind of pan out a little bit, is that blast path kind of basically travels from here to here, okay? So that radiation channel, okay, goes this way. And you can see with new conformal beam options and things that we do, we're trying to cone it to as much of the prostate as possible, and you want less collateral damage to the bladder, less collateral damage to the nerves that help with erection, less collateral damage to the rectum. So that, on that last note, using the word rectum, I'm going to turn the conversation over to Alex here, who's recently gotten trained and educated on a device called Barrigel.
Right, so thank you. So Barrigel is a material that we actually inject between the prostate and the rectum. So, under an office procedure or a light sedation in the surgical suite, we numb up the prostatic area, we numb you up your perineum, and we inject all of this material that creates a cushion between the actual rectum and the prostate. So that whenever you're having this radiation therapy, it's going through the prostate, it does not hit the rectum. So a lot of times patients, post-radiation can have radiation proctitis, they can have bloody stools, they can have constipation. So this Barrigel actually protects the rectum from that actual, that happening.
Right, so temporarily, people post-radiation may feel a little temporary fatigue, That can be a side effect. You can feel some urinary urgency and frequency, which is temporary typically. But then again, as Alex mentioned, your rectum takes a hit as well, and that can cause rectal urgency, frequency, what we call rectal toxicities. You know, and there have been some discussions, does that potentially increase cancer risk to the rectum because of that radiation exposure? So again, it is, like you said brilliantly, it's a gel cushion that's inserted between these two areas. And this gel, you studied about a little bit, is basically vast majority water, right?
Right, yeah. Natural components of your body already.
Right, and I think you know, one of the main components is hyaluronic acid, and this stuff is kind of super benign. Vast majority is water, and there's variants of this hyaluronic acid that are now being used all over your body. They're used as filler in your face and your lips, in many places. And the beauty is it's pretty benign, and it gets reabsorbed over time, and it just disappears.
That's right. I actually have another procedure that I do here in the office called Celesta, where I'm actually injecting almost the same kind of product into the rectal wall.
So topic of another video.
Yeah, that's right. But it is very benign.
Yes, yes. So, and easy to do. They can be done in the office, or they can be done in the surgical center. They're 15, 20-minute procedures, fairly benign, very, very low risk, but also minimizes the side effects from radiation exposure.
That's right.
So that's our